Everybody's heard of osteoporosis, and of course, it significantly impacts women. It's estimated to affect 75 million people in the United States, in Japan, and in Europe. It's way more prevalent in women. 1 out of 2 women before the age of 90 are estimated to actually experience an osteoporosis-related fracture, as opposed to 1 out of 6 men. So it's 3 times more prevalent in women. This is Women's Oral Health, and we're talking about osteoporosis. We're talking about the bones, right? We talked about the gums, we talked about the teeth, but now we're talking about the bones, and bones are everything. Essentially, osteoporosis is a condition that is characterized by loss of bone densities. So what does that mean? Well, in order to really understand this, just think about our bones. A child breaks a bone and we put a cast on it and they're back to new, right? It means that our bones are constantly forming, which is great. Our bones are constantly forming, and at the same time, they're also resorbing. And so it's this balance of formation with resorption that allows us to walk around and do things and be superstar athletes. But as we age, given our systemic health, our own general health, and then of course genetics, we may be at an increased risk for exacerbated bone resorption. And so that resorption is not being met with the formation, and the resorption takes over. And what happens? Well, we know relatives that have had hip fractures, vertebrae disorders. Things happen with our skeleton, and it can create arthritis. It can create pain, and it is related to the impacts of aging in women. So women that experience menopause earlier than what is average, before the age of 45, they start going through these changes, they may be more prone to develop osteoporosis. So we want to think about that with regards to our teeth, right? So what does that have to do with our oral health? Our teeth sit in our jaw, right? We have an upper jaw, which is attached to our skull, and we have a lower jaw, that mandible. As I always say, the mandible is like our long bones. You can sit it on the shelf and it's really dense and strong, but as we age, if we are experiencing accelerated resorption, our bone jaw also goes through this change. Just to give you some context, our teeth sit in a socket, and that socket it's a different type of bone. It's called the alveolar bone, and that bone sits in the jawbone. If you can imagine, as our bone may weaken or resorb, then our teeth lose their support structure, and that can lead to loose teeth, that can lead to teeth coming out. Let's say you always had gum disease. Gum disease is really prevalent regardless of osteoporosis. So then you couple that with osteoporosis, then you're at an increased risk of early tooth loss. And also, in the absence of teeth, patients that may have had prostheses like dentures, their dentures need to be replaced more often because of the loss of bone, the loss of structure for those prostheses. And that's really impactful in your experience in terms of enjoying food, speaking, and being confident. Everybody wants to live longer, and we want to live longer, happier, healthier lives. So osteoporosis is right up there with everything else that women are experiencing as they age throughout their life. And I thought it was really important to pay attention to this area. A lot of people would never think 1 out of 2 women are going to have a osteoporosis related fracture. Well, ladies, for me, I can hear my knees, right? I can hear my knees. I think about the exercises that I see my mother doing, just sitting down, standing up, and, just doing things, weight bearing exercises at the gym, building your muscle mass so that your muscles are strong enough to carry around your bones. Then that is really important. Also thinking about your diet, calcium, vitamin D, thinking about the supplements that you need to get. And that's why it really is not your oral health, but also your systemic health, talking to your doctors about what you need in order to maintain the balance in your system. So when we think about our teeth, we think about gum disease, periodontal disease, because the periodontium, keyword periodontium, is what attaches our tooth in our mouth. And so it's the gum, it's the bone, it's the ligaments, the actual fibers that are around the root structure that keep it in place, that allow it to flex. And so we also want to think about our TMJ. Women have a higher prevalence of TMJ disorders. They could be something as simple as, stress on the muscle, but also, as you can imagine, with arthritis, the joint, the temporomandibular joint, if the bone is weak, then that joint can feel distress. Talk to your dentist, talk to your physicians, and just think about your own behaviors. Of course, chewing certain foods, you may not be able to enjoy tough fibrous foods like you did when you were younger. It's important to also think about your hygiene, brushing, flossing, rinsing, and making sure that you maintain your regular dental visits. One last thing I wanted to talk about is if you are being treated for osteoporosis, then you may be given therapy such as bisphosphonate therapy. If you're going through menopausal treatments like hormone replacement therapy, you can have some dental complications. So it's really important for you to discuss your health and your treatments and your medications with your dental provider. Some complications could lead to death of your bone. It's called osteonecrosis, and it can be painful. It's when you may even see like your bone poking through your gum. Essentially, the blood supply to the bone is interrupted by those therapies. We have so many modifications that we do in order to maintain the health of the jaw, but it's important for us to communicate. I'm so glad you guys got on here for the weekend, and that's just some tips about osteoporosis and women's oral health. I'll see you guys next time. Bye.